Cancer is very preventable. Breast cancer, colon cancer, bladder cancer, liver cancer, they all have the same problem. They need glucose and glutamine. I can manage your cancer without toxicity on the cheap.
Meet Dr. Thomas Seyfried. He is a professor of biology at Boston College. He is renowned for his work on the metabolic theory of cancer, which challenges the traditional genetic paradigm of cancer. He is also Amazon's best-selling author of the book Cancer as a Metabolic Disease. In today's video, we have extracted Professor Seyfried's teachings over the years and listed 5 key things you must know about cancer. In the final part of the video, we will focus on how a metabolic approach can be used for cancer prevention. Let's dive into it. Cancer is a metabolic disease, not a genetic disease.
The problem is that there's a misunderstanding about what the nature of the disease is, and this is the real issue. It's the failed recognition that cancer is a metabolic disease. It's not a genetic disease. Here in the United States, National Cancer Institute, on their website, they say cancer is a genetic disease caused by mutations in specific genes, tumor suppressor genes and proto-oncogenes and these kinds of things. And this leads to a dysregulated cell growth. And this is the dominant, consistent view we have right now, the somatic mutation theory, where the mutations arise randomly in a population of cells, which then leads to disorder of the cell cycle and the proliferation. But you have 2 different kinds of genes. You have those inherited in the germline, and you have those that are acquired through various insults in the environment. So what these inherited mutations are doing, and we went through all of the inherited mutations, and all of the inherited mutations, risk factors, damage mitochondria in a particular way, putting them on the path to destabilized energy metabolism and a consequent fermentation metabolism. So the inherited mutations are what we call secondary risk factors, not primary risk factors. But how would they reduce the probability of that inherited mutation causing cancer? And you're absolutely right. Cancer cannot occur if the mitochondria in the cell remain healthy.
Professor Seyfried frequently mentions about the 2 main fuels of cancer. What are the 2 primary fuels that cause cancer?
It's a metabolic disease that's driven by 2 fuels, the sugar glucose and the amino acid glutamine. And these 2 fuels are the ones that drive the dysregulated cell growth, which is ultimately the definition of cancer. So when people say, what is cancer? It's dysregulated cell growth, cell division out of control. What is it driven by? It's driven by a form of energy that doesn't require oxygen. Oh yeah? Well, what doesn't require oxygen? Well, fermentation mechanisms. Oh yeah, what's that? Well, you use fuels that don't require oxygen. What are these fuels? These fuels are the sugar glucose and the amino acid glutamine. Wow, that seems simple. How come nobody's targeting these fuels to manage cancer? Because they think it's a genetic disease, not a metabolic disease. Not that complicated.
According to Professor Seyfried, factors such as the availability of highly processed carbohydrates, lack of exercise, emotional and mental stress, and insufficient sleep negatively impact our biology. These combined factors not only damage mitochondrial efficiency, but also diminish the overall joy of living. Together, they can increase the risk of developing cancer.
So the 2 fuels that are driving, now we can't completely remove glutamine by exercise, that's for sure. But my late good friend George Cahill published some papers on showing how exercise could actually lower glutamine availability. You can use diet and lifestyle to lower blood sugar for sure, but you need drugs that will interrupt the glutamine pathway, the glutaminolysis pathway, essentially. But we do it we pulse it. We don't do it too aggressively. Knowing the value of glutamine for the normal physiological function of our body, you can't go after glutamine aggressively because you're going to harm the body.
While discussing about cancer treatment, Professor Seyfried often discussed several flaws and limitations of the traditional approach of cancer treatment.
But they're told what to do by the AMA, American Medical Association. The standard of care is like written in granite, and their job is not to question the standard of care, but to follow the rules of the standard of care, which then if you come in with lung cancer, breast cancer, colon cancer, bladder cancer, they have a protocol that they use to treat that. Surgical first, perhaps, radiation, perhaps, a treatment program for some drug. and there by the grace of God, you survive. But a lot of people don't survive. And that's why we have over 1,600 people a day, every single day, dying from cancer in this country. And it's over 8,000 a day in China, and it's rampant throughout the world. So for glioblastoma, the brain tumor, if you're surviving after 5 years, there may be 5 or 7% of people that get standard of care that actually survive 5 years. The standard of care is your problem. So you got to get rid of the standard. It's not working. The standard of care for brain cancer, at least for glioblastoma, is not working. It's not working for advanced lung cancer. It's not working for advanced breast cancer. It's not working for a systemic metastatic cancer. The standards of care are not working. And that's what's killing the majority, allowing these poor people to be dead.
So what is the metabolic therapy that Professor Seyfried suggests?
So once you know the biology of the cancer cell and the biology of the normal cells, you just play one group of cells off the other in the correct metabolic environment, and the tumor cells lose every time. Fatty acids and ketone bodies are non-fermentable fuels. They cannot be used by tumor cells, but they can be used by normal cells that have normal mitochondria. So the solution to the cancer problem is simultaneously targeting the fermentation metabolism of the cells, which is the glucose and glutamine, but by transitioning the body over to ketone bodies, which allows the normal cells in the brain and all of the organs to function, and fatty acids for the liver. Tumor cells can't use fatty acids and ketone bodies. So the solution to the cancer problem is very simple. You have to simultaneously target the fermentation while transitioning the body over to fuels that cannot be fermented. And this now puts massive pressure and kills the tumor cells without toxicity. So we use a combination of diet and repurposed drugs in what we developed called the press pulse therapeutic strategy for managing cancer, where we bring the body into a state of very low glucose, high ketones, and then we hit the surviving tumor cells with drugs that can target and disrupt the glutamine pathway. When you say ketogenic diet, it's actually, you got to be very careful because it's not necessarily a ketogenic diet. It's the state of being in therapeutic ketosis. And a ketogenic diet can put you in therapeutic ketosis, but many of these so-called ketogenic diets are not done correctly. People go out and eat too much of it. They don't do it the right way. It's nutritionally imbalanced. Yeah. I mean, but the bottom line, the underlying theme here is nutritional ketosis prevents chronic diseases.
So, Professor Seyfried suggests that a ketogenic diet or therapeutic ketosis is a non-toxic approach of preventing cancer. In the final part of the video, Professor Seyfried will guide us on how to measure the glucose ketone index.
We use the glucose ketone index calculator, which we published here. That gives the patient, every patient with cancer can then know how they stand. So it's a meter. You can buy it on Amazon, a Keto Mojo glucose ketone index meter, a meter that measures blood sugar. You prick your finger like a diabetic would. You measure with a strip. You can measure your blood sugar. You put the strip in the meter, it reads the sugar. Okay, squeeze your finger a little bit more, put the ketone strip, put that in the meter. It tells you what your ketones are. You push the button and you get a ratio of how much ketone to glucose is in the blood. And normally people would look at that right after their lunch or dinner or whatever, and you'd have a value of about 50 or 60. Okay, to manage cancer, you need a value of 2.0 or below. Doing metabolic therapy requires a big effort on your part. The patient has to play a major role in the management of the disease, otherwise it's not going to work. So when the patient can get down into that low GKI value, then the patient becomes now the next step is use specific drugs that work better against the glucose and glutamine together. So you got the diet on the one side, making you healthier, putting pressure on the tumor cells, but then you hit them with low doses of a variety of other, and some of that can be low dose chemo, by the way. And then you just start hammering these tumor cells out of existence. So, and degrade them slowly while you continue to be healthy. None of this hair loss, vomiting, and all this other stuff. The tumor cells cannot survive in these harsh and metabolic environments.